Discussing nutrition, fitness and mental wellness, Health Matters at Crossroads, only on Bulozi TV, the pride of Bwalya. Get ready to take control of your health. Your health is at Crossroads. Discussing nutrition,
This is Your Health Matters at Crossroads. I'm your host, Bwalya Beal. We are coming to you live from Bulozi TV, the pride of Bwalya. We are on channel 120 TopStar decoders. Not only on TopStar decoders, we are also on Facebook. Simply go and type Bulozi TV, you will find us in this studio. Not only on Facebook, we are also on YouTube and other social platforms. Simply type Bulozi TV, you will find us live. As we are speaking to you, we are live. We are going to open the show at some point where you can get through to us. In case you have a question, you are going to call us on 0773 738114. That is the line you are going to use so that you can interact with us in case you have health issues that you would want our guest today to respond to you and clarify and explain in depth from a professional point of view. As you always know, your health is your wealth. Always take care of your health so that you can be health and wealth. Today our topic is HIV and mental health. We want to find out exactly what it is. What is the correlation between HIV and mental health? So to discuss this topic, I have a guest in the studio, Madam Kashweka. Madam, welcome to Health Matters at Crossroads.
Thank you very much. It's my pleasure.
Sure. Maybe for the sake of the viewers, they would want to know you better. Can you tell us more about yourself?
Okay.
And where you are coming from?
All right. My name is Kashweka Liyembani. I'm a senior clinical officer at HH Hospital. Mika chenu musiari oluinsi hamu kwambola kaza HIV and concerning mental health.
Okay. So what is mental health? In your own, let's say a layman's language, what is mental health and how does it mean to you?
Okay.
If possible, we want to Bonaluch and to understand what mental health is. And
okay. In simple terms, what I can say is mental health. It's not necessarily the absence of mental illness.
Okay.
What I can say is mental health, it's a vital state of a person's psychological, emotional, and social well-being. In short, kimutu mwaingera bupiro bwahaye mwapirera, how a person is able to handle their emotions in a healthy way.
Okay.
I think kabukuswa ni kwa mukwa kubulera mental health.
HIV,
yes,
is one of the diseases that has hampered our community and the nation at large. Not even the nation, but even the world at large.
Yes.
Is there any correlation between HIV and health? Does it affect mental health in any way? If yes, how?
Yes, HIV and mental health, they go hand in hand.
Okay.
Especially in our communities where there's a lot of stigma.
Okay.
Where people go through stigma and discrimination, which makes them vulnerable to experience a lot of emotional states.
Okay.
Yes. Kakuri mutu afumane akuruna ni HIV. It's not an easy thing. It is something that they have to process it after the diagnosis. They have to deal with a lot of emotions. Some people, they will deal with the emotions of sadness, emotions of fear, emotions of loneliness. Some, they might even lose hope.
Okay.
Bakona kuna nange uti no pa imizi HIV positive kona kuli bupiro waka kebwezanyi kebufera. My dreams yaka kaufera nene ni my plans kafera kaezanyi kerafera. But it's not like that.
Okay.
That's not how it is. With support, with counseling and support from the members of the community and from loved ones, people living with HIV are able to attain a good mental health.
Okay.
And fulfill and live very healthy lives.
Okay.
Yes.
Okay. Now, when it comes to family, because most of these people who are suffering from HIV and AIDS, they are family members. Some are colleagues, some are friends. How can family and friends support someone living with HIV who are struggling emotionally?
To people who are, we all have, I'm sure everyone, like nowadays in this era, Kafela Luna, we have a person at least who is positive. That's why they say that if you are not affected, if you are not infected, you are affected, or vice versa.
Exactly.
They go hand in hand. The way we can support people living with HIV for the sake of their mental health is, one, by listening to them.
Okay.
When a person has been diagnosed with HIV, the first thing that they want is they want to be listened to without being judged.
Okay.
We can be there, support them through their medications, through the treatment. Remind them when it's time to take their medication. We should not discriminate against them, no. And the other thing is, if your loved one, you are seeing that the person, despite the support they have, their emotional state is still not okay, the best that you can do is to seek professional counseling for them.
Okay.
It helps. To seek help for them. That's the best thing that you can do.
Okay. So how do they break down emotionally? Can you touched a bit, but I would love you to explain in depth, because I know Woinonge would want to understand and make sure, if possible, use local language, how people who are suffering from HIV, how they are affected emotionally and mentally, if possible, psychologically, and how do they survive? How do they manage to come out of such a situation?
Yes.
Sure.
The way people, I'll take it from the beginning. From the beginning, we have a scenario where someone has gone to a health facility. They have been tested. They have been found to be positive.
Okay.
The emotions that they go through, the first thing they go through, they experience, my emotions are mangata for same time. Angata yashuta nanga kamutu ni mutu. There are some who handle it well, but there are some who can break down completely.
Okay.
As a result. So you find that in the beginning, when they receive a diagnosis, the first thing they'll go through, some they'll be shocked. Because there are some people who have never in their lives expected that they can be positive.
Okay.
So with that, it will come shock. With that, it will come fear. Fear of the unknown, fear of a lot of things. Because you know HIV and mental health, they go hand in hand. And in the society, there are myths out there.
Okay.
Which are not true about HIV and mental health.
Okay.
Yes, there's a lot of misinformation out there. So when a person goes to a center, having that in mind, and they discover that they are positive, a lot of them, they can be stressed. They can even go through depression.
Okay.
But the good part is, there are a lot of counseling services that we offer. They have a lot of people whom they can talk to. We have a lot of support groups, even within the community.
Okay.
That they can feel at peace. that they can talk without being discriminated. The support is there, even the treatment is there. With treatment, people living with HIV, they can combat mental health challenges.
Okay.
Yes.
Are you in a position to give us a few examples of myths that are in the society that people or patients are exposed to, which would trigger mental health challenges?
Yes. For example, some people in this time and era, believe you me, there are people who still think that if they associate with a person who's positive, other people might think that they are also positive.
Okay.
So you find that in such a case, they shun away from people who are positive, meaning that those people are left isolated from the activities that happen in the communities. And as such, it usually has a negative impact on the mental health of people living with HIV. So misinformation in the community is the #1 cause of stress for people living with HIV.
So people who are living with HIV, they can participate in any activity. They can interact with anybody. Let's say just physical interaction. It can't be transmitted to another person just by eating together, maybe sleeping in the same bed or sharing the same clothes or exchanging clothes. There's nothing like transmitting to another person.
No. HIV cannot be transmitted like that.
Okay.
You have to have fluid contact. You have to come in contact with fluids of the person who's positive. And it's not always the case.
Okay.
Nowadays, with treatment, a lot of people, they have attained viral suppression.
Okay.
So those myths of no, just a little bit, then I'll have HIV. It's not like that. There's a lot of effective treatment which is there, and people living with HIV have a lot of support.
In your own opinion, Madam Kashweka, how does stigma and discrimination affect the mental well-being of people who are living with HIV and AIDS?
Yes, stigma and discrimination, it really does affect people living with HIV and AIDS in their communities. Because if those people are stigmatized, what happens is they start shunning away from seeking treatment. It is some of them, it can even make them to default. Kutwera kunwa nimiliani. Libaka la kusaba kuli no abakaziba kuli ninani utuku bakako kwani kuli mwendi bakani seha bakani bulera. So at the end of the day, peto basaba kuweza seek medical treatment kakai kwa spatela. Bakala kuikeza isolate isalibona. Bakensa kuli basaba kuli no nani kako kwani. Angata in some communities, you find that because they are stigmatized against that person, they are stigmatizing against that person, they even start not involving them in community activities. Bakala kuketulula. At the end of the day, because of ketulula, it has a direct impact on the mental well-being of those people. Baba mubaba depressed. Baba mubakala kupira in fear. In short, baba depressed. Batuera kweza function. You find that they can't function well in the society. What is expected of them, they can't do because of discrimination and stigma. Discrimination and stigma, it's something. It's really a challenge in our communities, something that we should address through education and information in our communities.
Well, viewers, you are watching us live from Bulozi TV, the pride of Bwalya. This is Health Matters at Crossroads, where we discuss matters pertaining to health. We value your health. That's why we always bring this program to you so that you can be healthy. When we are healthy, we are going to have a healthy nation, a healthy society, a healthy world where we can be living freely. Although we cannot be 100% the entire world healthy, but we will strive to ensure that we safeguard our well-being. This month we are looking at mental health, and today in particular we are looking at HIV and mental health. In the studios we have Madam Kashweka, who's coming all the way from HH Hospital, who's a senior clinician, who's helping to discuss or helping us understand how HIV is related to mental health, or how these people who are suffering from HIV get affected mentally, and it affects their mental well-being by way of our conduct. Some of us, we don't treat them well and we stress them. So this program is going to educate us on how best we can learn how to interact with such kind of brothers and sisters so that we can promote their mental health as well as ours. In case you have a question, you can get through to us on 0773 738114. Madam Kashweka,
Yes.
what could be the health ways that people who are living with HIV and AIDS could use to combat depression, anxiety, or any healthy mental related issues? Which method can they use so that
Yes.
at least they can clear their mental state?
The healthy way that people living with HIV can combat HIV and mental health is, one, they should be able to seek help, to talk to someone. The first thing that you do as a person is when you talk to someone, it opens up the burden.
Okay.
Yes. So the first thing that they can do for that emotional stress, in order to get rid of the emotional burden that they can do, is talk to someone, join support groups. We have support groups in communities, even at the hospital. If they cannot do that, seek counseling, talk to a loved one, talk to a close one. And they can also do that in healthy ways. Because there are some, because they want to release the emotional burden or they want to release some stress, alcohol and substance abuse is not a healthy way to relieve stress. Yes, there are other health ways, like you can have hobbies. People can have hobbies. Kuna nili kaze ngata zako na kuweza moto. HIV does not define a person. So, before HIV, unanima hobbies yanataveranga kweza. Whether it's football, whether it's dancing, it's still okay to do it. And the other thing is eating a healthy diet. Learning to take care of oneself is also a healthy way to do it. Yes.
Okay. I believe we are learning. Let's avoid substance abuse to cope up with stress and depression. Actually, you would worsen your situation if you were to go that route of using harmful substances. So let's make sure, the health expert has said, you make sure, indulge yourself in health food, eat health food, do activities, go for sports. If you have had hobbies, make use of them. That way, it's going to help you release the stress. That's all. Is that what you say? Yeah.
Yes.
It's going to help you release stress, anxiety, and depression. So make sure, look for support. You mentioned of support groups.
Yes.
Now, how and why is it important that somebody who's suffering from HIV and AIDS should seek counseling and help from support groups? How does it help them?
Yes, with emotional burdens, sometimes when a person is living with HIV, the emotions can become overwhelmed. So by seeking a support group, these support groups in community, they are for people who are in the similar situation, in a similar position, for people who are also HIV positive. So by being in touch, being involved in such support groups, those people, there are people who have been living like that like for a long time. They can support each other. For parallel way, for bona could is too much. There is someone in that group who has gone through that, who can help you, to combat the challenges that you are facing at that particular time, for the wellness, for your own mental health. So when you go there, it makes you feel homey, because people have been in that. It creates a safe space for you to express your emotions and to find solutions through people who have been there. Because for counseling, when someone goes for counseling, there are people, they talk without being judged. When you be there, you'll be given an opportunity to express yourself. Because most people, they fail to deal with their emotions because they don't have just people to talk with. And when you go seek counseling services, it provides that. Sometimes for our own mental well-being, everyone sometimes needs a listening ear.
Yeah.
And you find that sometimes there are some people who fail to find that somewhere else, and they can find that through counseling and support groups.
How can communities help reduce stigma and promote positive mental health for people living with HIV?
The community can help.
So I think I would appreciate if you can use local language and look direct in their eyes, so that they can fully understand and take part as a community on helping reduce this stigma.
Okay.
Sure.
Moko inezi. Ma community, awenzi ma community. Lusikwata sirisimu. Miru kona kutusana. Kutusa batu abapiraka ni HIV. Kutusa sabu inero wabona. Muloko na kwezeza, one, kikuambola. Kuambola zabu tukubwa HIV ni mental health. Kakuli muambole lasika, kona mosi bonari la bunolo. The more you talk about something, the easier it gets, the easier it sounds. When people would talk about HIV and mental health out there, even if there was someone who still thought of stigma, it won't be there. The community, what they can do, another thing to combat kweza kuli stigma, kubula this utuko wa stigma, ni discrimination in our community, because utuko ni bona. It's a cancer, because people living with HIV, this really affects them mentally. So mako na kwezeza watu kutuelisa stigma ni discrimination. Kikweza involve fokumaona ni activities kweza involve bale batu babapira ni butuku bwa HIV ma community aluna kuba treata inge molu yezeza batu kaufera kuliruskerwa abaniketululu kubona. Treating them like the way any other person is treated, bringing them closer, treating them with respect, with kindness. That one, it will go a long way in terms of their mental health. I think doing that, it will show less and less. With time, there will be less and less stigma and discrimination in our community.
There could be someone who is suffering from HIV and AIDS, or is living with HIV and AIDS in the community, and they feel isolated and helpless. What message do you have for such kind of people?
Okay.
So that at least as they are watching, they can be blessed with your message.
All right. What I can tell, what I can you seek counseling, seek help. Sometimes seeking help, it does not mean that you are weak. No. Sometimes the best that you can do for yourself is to seek help, seek professional help for your own mental well-being. So abanji kuna ni mutu ya inzi somewhere, you are positive. Iske wasaba zama kwa spatira sesinzi buka ofi ukafumana batu baba inzi ready, baba inzi willing kukweza support, baba inzi willing kukuteleza kwa mbola ni wena utakuli, you sit there and be depressed.
Madam Kashweka, as we are coming to the conclusion of the program, what changes would you like to see in the community to improve mental health support for people living with HIV?
Yes. The changes that I'll have to see in our communities, it's one, having more education about HIV and mental health is needed in our communities. I would like to see less and less stigma and discrimination against people living with HIV for their own mental well-being. I would like to see people talking about HIV and mental health freely without being stigmatized. And I would love to see people giving support openly to people who are living with HIV and who have mental health challenges. That's what I would love to see in our communities.
Yeah, it's been a pleasure having you on the show as our guest. What could be the last word that you can tell our viewers as they are listening and they are watching, so that they can go, as they are switching from this program to other programming, they at least it should stick in their mind and keep or remain ringing. Any last word, Madam Kashweka?
Yes.
If possible, I would appreciate if you can use local language so that everyone can benefit from your last words. You know, last words are always important. You know, even when parents are going, they will say, my children sit here, here is my last word.
Okay. HIV and mental health, it's us, all of us. Itokwa support ya community ya luna, ma communities ya luna. Kafe ya luna ni role ya kweza play, kweza combat this problem that we have, this challenge that we have. Because izo mama communities ya luna, mimane kiluna wako na kuba ni mindset ye chincha, kuchincha kutisa change. Kakuli, in this time and era for foreigners, iiswane kuba challenge ye bati. Kuna ni a lot of information about HIV. A lot of it out there. Lwakona kubereki sana hamu. Ma community ni health. Kuna ni ma counseling centers ya mangata. And kuna ni batu baba is that they are readily willing to help. And together, us and the community, through people, through our communities, we can stop this. We can create a better health and better mental health for people living with HIV by making our environment and our communities conducive for them, where they can express themselves freely without being scared of being stigmatized, where we can offer support kubato bapira nika kukonika HIV kakuli kiba na baboluna akibatu basiri bati kibatu beruziva kibatu beruchani bona kibatu bato kwa support ya lona kuli nibona bakone ku bani upira obunde bakone kupira hande.
Well, thank you so much. It's been a pleasure having you on this program as our guest. We have learned a lot from you, madam. I believe viewers, we have learned one or two things. This is Health Matters at Crossroads. I've been your host, Bwalya Beal. From the studios, on the technical part, we have Mr. Fanuel Piri. And our guest, of course, this is Madam Kashweka. We are saying goodbye. Continue watching the rest of the programs on TopStar channel 120. That is on Facebook. Simply type Facebook. You can also check on our YouTube page. You can also check on our TikTok page. You will find a lot of interesting programming. Those who are in Lusaka, they are watching us live as we are broadcasting now. There are also people in Chongwe. We are also in other towns like parts of Senanga, Nalolo, part of Nalolo, part of Lewani, what do you call this? Limulunga. We are not countrywide, but we are being covered in parts of the country. So continue enjoying the rest of the program. For us, we say bye-bye.
Fitness and mental wellness. Health Matters at Crossroads, only on Bulozi TV, the pride of Bwalya.
Not long ago, many children